Robotic joint replacement is nowadays very advanced. We are doing many joint replacement surgery through robotic technology. There are various myths and misconceptions about the robotic joint replacement. Today we are going to debunk those myths and get into the reality which we call as evidence-based reality. Hi, I'm Dr. Mohit Madan. I'm Senior Consultant Orthopedics and Robotic Joint Replacement, Dharamshila Narayana Hospital and my Ortho Center. That's an advanced surgical center. Robot performs the surgery on its own. Robot does not perform surgery independently. Robot and surgeon together performs the surgery. In a robotic joint replacement surgery, surgeon provides a real-time data to the system and the system generates a 3D model. On that 3D model, surgeon with the help of robot performs the surgery. So robot is just like a tool or an instrument which is in the hand of surgeon, and it provides precision in surgery, and that's why leads to better results. Robot surgery is in experimental phase and it is unsafe. Robotic surgery is FDA approved and it's widely used. It is already performed in thousands of surgery. Robotic joint replacement is add-on to the joint replacement technique. It is not a newer treatment and not in experimental phase. There is no difference in traditional joint replacement or robotic joint replacement. Robotic surgery is add-on to, you can say, traditional joint replacement. So it provides you a more better outcome than traditional joint replacement in terms of better implant positioning, smaller cuts, lesser blood loss, and early rehabilitation in some of the cases. But overall results of a surgical procedure depends upon surgical expertise and patient-related factors. Robotic surgery provides early recovery in all the patients. Robotic surgery do provide quicker recovery or faster recovery in some of the patients, but recovery of a patient after surgical procedure depends upon many factors. They are patient-related factors, complexity of the surgery, deformities present before the surgery that we call as preoperative deformities and disabilities, and the age comorbidities from which the patient is suffering. And it depends upon the muscle and the bone strength of the patient. So the recovery depends upon many factors, but yes, in some of the patients, it do provide early recovery because there is a smaller incision and lesser blood loss. The robotic surgery is only meant for active and young individuals. Robotic surgery is useful in wide variety of patients. It is not limited to the active or younger individuals. It is also good for older individuals, as robotic surgery is good in complex cases and where there is a lot of deformities and complexity. So it provides a better results in form of precise placements of the implants and better alignments. So it is useful for all. It's not limited to the younger or active individuals. Robotic surgery is very expensive. Robotic surgery is a bit more expensive than traditional joint replacement. It is not that expensive because in robotic surgery, there are few extra consumables, markers and trackers are required, which cost few thousand rupees. So it is definitely costlier than traditional joint replacement surgery. Robotic surgery is now very advanced and it helps surgeons as well as patients in getting good results in joint replacements. Whoever is considering joint replacement surgery can go for robotic joint replacement surgery because it definitely provides a precise implant placement, better alignment, and that in turn leads to better mobility for the patients, better pain reliefs, and definitely going to increase the longevity of the surgery. Thank you.